To palpate the pubic bone, place your finger on the navel. Slowly move down the midline to the pelvic region. There will be a firm ridge, about 5 to 8 inches of pelvic crest. You will be 1 to 2 inches away from the genitals. To palpate the ASIS, the patient is supine. Place your hand on the side of the abdomen below the level of the umbilicus. Compress inferiorly until you feel the superficial tip of the distance between the two ASISs. To palpate the AIIS, patient is supine. Flex the hip by bending the knee to shorten and soften overlying tissue. Locate the ASIS, slide inferiorly and medially, approximately 1 inch. Palpate deep into the overlying tendons and move around until you feel a small mound of the AIIS. To palpate the iliac crest, the patient is supine. The iliac crests are easy to find. Find the ASIS and palpate upwards. To palpate the greater trochanter, the patient is supine. Keep your fingers on the ASIS. Move your fingers down until you feel a bony knob. It will be easier to know that you are at the greater trochanter if you have your patient internally and externally rotate their hip. To palpate the tensor fascia lata, the patient is supine. Locate the ASIS, palpate inferiorly and laterally. Ask the patient to alternate medial rotation and relaxation of the hip. You will feel the tensor fascia lata contract beneath your hand when the patient medially rotates. We are going to palpate the femoral triangle, which includes the sartorius, adductor longus, femoral artery, and the inguinal ligament. Have your patient in the supine position. Have them cross their leg over their opposite knee, making a figure 4. The femoral triangle's lateral border is the sartorius. The medial border is the adductor longus. The femoral artery is easily palpable in the middle of the triangle, just below the inguinal ligament, which is the superior border. To palpate the ischial tuberosity, have your patient lay down prone. Find the crease between the buttock and thigh. This is called the gluteal fold. Place your fingers in the center of the gluteal fold and firmly press superiorly and medially till you hit a larger surface. This large surface is the ischial tuberosity. To palpate the sciatic nerve, have your patient prone. Have your patient flex the hip. Locate the ischial tuberosity and greater trochanter. Palpate between these landmarks for the pathway of the sciatic nerve. We are going to palpate the gluteus medius and minimus together. With your patient side lying, isolate the shape of the gluteus medius by placing the webbing of one hand along the iliac crest, while the other hand locates the greater trochanter. Your hands will form a shape that looks like a slice of pie. This is the outline of the gluteus medius. Palpate in this area from just below the iliac crest to the greater trochanter for the dense fibers of the gluteus medius. Sink your fingers deep to the gluteus medius to explore for the density and mass of the gluteus minimus. To palpate the gluteus maximus, ask the patient to lay down prone. Standing to the side of the patient, place your index finger on the coccyx and your thumb on the posterior suprailiac spine. The webbing between your fingers should lie along the posterior 2 inches of the iliac crest. With your other hand, palpate the gluteal tuberosity. Your hands create the border of the gluteus maximus. To palpate, feel within the borders.